Millions of Americans may soon be eligible for Moderna's coronavirus booster shot. An FDA panel voted Thursday to recommend a half dose for vulnerable populations. The company's data will soon head to the CDC. Meanwhile, President Biden delivered remarks on the nation's coronavirus response. He says in the past 6 weeks, daily infections have fallen by nearly 50%. But still, there are 66 million eligible Americans who have not gotten vaccinated. Maria Villarreal reports from Dallas.
So right now we know that advisors to the FDA said part of the reason why they decided to recommend the boosters was because of the shortage of healthcare workers. They basically said we can't afford to have them get sick, get infected, and stay home when there is this dire need. Now, we do understand the FDA Advisory Committee voted unanimously today to greenlight the Moderna booster. The recommendation applies to people 65 and older and adults who are high risk, young adults, because of underlying health conditions or where they work. Now, those who are eligible will receive a half dose at least 6 months after their second shot. Experts basically telling us that right now it does look like the Moderna is more robust in comparison to the Pfizer vaccine. Now, meanwhile, there is a study out by the National Institutes of Health that has not yet been peer reviewed, but says that mixing and matching of the vaccines is actually safe for a booster shot. Now, we do understand the panel will be discussing the J&J vaccine tomorrow. After the FDA officially authorizes all of this, the booster recommendation will then be refocused to the FDA, the CDC that is, and the CDC will meet late next week. So right now, the earliest that Americans could potentially get these boosters will likely be next Friday.
Dr. Shad Marvasti joins me now. He's the Director of Public Health Prevention and Promotion and an Associate Professor at the University of Arizona College of Medicine, Phoenix. Welcome, Dr. Marvasti. As we just heard, FDA panel unanimously voted to recommend booster shots for some recipients of the Moderna vaccine. So tell us what happens next.
Well, what happens next is very similar to what happened with the booster for the Pfizer vaccine, where now we've had nearly 9 million Americans get their booster shot. We go from here to the CDC Committee on Vaccines to be able to approve it. And once that gets approved, presuming everything's in alignment, and there's no need for overrule as there was in the case previous with the CDC director, things would move forward and people would be able to get their booster shot, those who had received the Moderna, just like they are able to right now for Pfizer.
And remind our viewers, what do we know about the potential side effects of Moderna's booster?
So as you know, Moderna's booster is the same mRNA technology as the Pfizer, but much higher dose. So the original 2-dose regimen for Moderna is 100 micrograms. That compares to 30 micrograms for the original Pfizer. That's why the booster is only 50 micrograms. And people who are younger, there is a higher risk of myocarditis, which is basically inflammation of the heart muscle. And that really is a result of a more robust immune basically reaction to the vaccine and the immune response, which is more robust in younger people in general, and with the higher dose of Moderna. That's why there's an increased risk. That's what we understand at this point.
All right. Israeli health officials presented data on booster shots to the FDA panel. They said that boosters, quote, improved protection and had a similar safety profile to initial doses. In fact, what you were talking about was exactly that. 4.9% of fully vaccinated people here in the U.S. have received a booster already. How relevant and useful are these findings to U.S. health officials?
Well, I think it is definitely useful because the numbers in Israel are showing a break in the epidemiological curve in terms of stemming the tide of the pandemic there. We think it could be in part attributable to a tipping point of booster shots, but it could also be in part because of the fact that, you know, it's the Delta variant has been there for a number of months, and you do also have a percentage of the population with natural immunity. So it's probably a combination of factors, but having the boosters, which is shown again from this study to have increased antibody levels that are not insignificant, definitely is a protection. It definitely, sets them up for success. So I think it is relevant to look at that here, especially since we don't have universal mask laws or public health mitigation measures and, any kind of national standards outside of transportation between states. So the virus is able to move freely and continue to spread.
But there are some vaccine mandates, and President Biden has been addressing recent pushback against those. He says that the nation is in a critical period and that vaccine requirements, quote, should not be another issue that divides us. How important would you say mandates are to our recovery?
I think mandates are critical to keeping the economy open, just like masks are also critical. So vaccines, masks, and also ventilation. HEPA filters data has come out to show that to be very significant, and also in terms of indoor air quality. You know, a lot of what's happening right now parallels what was happening in the 90s, where there were arguments made about public smoking laws. Before that, in the late 70s, laws about seatbelts. This is really culture versus science, and eventually, culture has to accommodate to the importance of community choice, where our decisions impact others. And then we have to take that into consideration. So I think it's pretty critical for us to get through this pandemic in the same way as we've addressed other public health issues like public smoking and seatbelts. We need to do that with masks and vaccines right now for us to be able to move forward with a strong economy and a healthy community.
Before I let you go, I want to talk a little bit about children. A senior advisor to the Department of Health and Human Services say that children's hospitals are, quote, really hurting as they battle not only the coronavirus, but also a mental health crisis. Explain to us the toll that this past year has taken on pediatric facilities.
Oh, it's a huge toll. I mean, we talk about adverse childhood events in my medical school, and I think this is definitely a huge one on a grand scale. From a physiological perspective, kids hunkering down didn't get seasonal illnesses last year, so they didn't build immunity to viruses, which is why we're seeing a lot of RSV, other viruses. So hospitals, children's hospitals are full, not just with COVID, but a lot of these other infections. But from a mental health perspective, we really can't underestimate the developmental detriment of being isolated at home, away from your friends, at a very key time of childhood. And so I think we're going to be still examining this for years to come. And I hope we can mobilize resources to address mental health and do what we can to keep kids in school, which is to have masks, eventually add the vaccines as part of the vaccine schedule requirement, as with, measles, mumps, rubella, everything else, and use the HEPA filters, basically all science-based, to keep kids in school because they need that in-person interaction for social, psychological, mental, and emotional well-being.
All right. Dr. Shad Marvasti, thank you.
My pleasure. Thank you.